Hi, I'm Colleen Salazar, lactation consultant and student midwife. And today I want to talk to you a little bit about hand expression. And hand expression is actually a term that we use for moving milk with the hand. And so for breast and chest feeding folks that aren't going to use a pump, they can use the hand. So there are 5 different advantages to using the hand over using a breast pump. And the first is equipment cost is 0. The second is that it may provide actually more effective milk ejection reflex, so the release of milk might be more effective. And it's always available. You have it wherever you go. And number 4 is that you provide compression for the breast rather than suction to remove the milk. And number 5 is research with preterm babies has shown that if hand expression is done in the first hour of life, there's actually more milk available in that first week of life. So it's kind of cool. And so when would you do this? If you don't have a preterm baby, have a full-term baby, and you're wondering when you should do this, if you feel fullness that feels uncomfortable, and sometimes that can happen on day 3 when our milk amps up in volume, and baby latching onto the breast is more difficult. Sometimes just releasing a little milk helps with that. So I like to say that the breast should feel like the skin on your forearm, should feel soft and supple like the skin on your forearm. And when someone's engorged or feeling extremely full, it feels more like the back of your hand. And if you could imagine baby trying to get their mouth around that firm skin on the back of your hand and actually get a mouthful of tissue, it makes it a little more difficult. So what you need for hand expression is your hand and a probably private environment, and to be calm. So you might want to take a few deep breaths, maybe 2 or 3 deep breaths, and calm yourself. Some people use warmth to facilitate the letdown, to help release the milk. And I like to use just a diaper with warm water in it. I just put warm water, a few tablespoons of warm water in the diaper, and then you could place that onto the breast. And this is my breast model. So you put that right onto the breast, and then you could even put your bra right up over it and just leave it on for like 5 minutes and before doing hand expression. And then you probably want a spoon or a cup or a washcloth if you're not going to save the milk. So spoon if you're doing colostrum, because it's small amounts. And then how you actually do it is you place your fingers about a finger's width from the base of the nipple. You place one finger and then a finger's width from the other across from that, so that you're kind of in the same alignment there. And you actually just press back into the breast. So this is the chest wall, and you're just pressing back into the breast, and then you compress and you relax. And so it's press, compress, and release. Press, compress, and release. Let's see if you can see it. Let's see. So it's a press, compress, and release. I'm not sliding at all down the breast, okay? So when you're doing these, usually with early milk and when it's a colostrum phase in the first few days, you probably need to do this 15 to 20 times before you start seeing milk moving and you start seeing the drops. So if I were doing this and I was going to collect the milk, I would do it just like this with my middle finger and my thumb, and I just kind of push back and compress. And as the milk starts coming, I would just hold the spoon at the base of the nipple and let it just drip right down onto the spoon. And then I could feed that to baby. They are happy to lap it up if you just put it by their upper lip and they stick their little tongue out and lap it up. And then if you're replacing a feeding, like you're down the line 3-4 months down and you're now just going to go out for a few hours and you want to get some milk out, you probably would have to hand express like this for 15 to 30 minutes probably, to really get enough milk to be able to give to baby. So you wouldn't just do this just short term, like short, a couple minutes on each side. You would do it like you're replacing a feeding. So does that make sense? So yeah, so that is pretty much it. If you would like to watch a longer video with like real lactating folks, on it. I'm going to connect Dr. Jane Morton's Stanford video below. And if you have more questions for me, experiencebirthandbeyond.com. Thanks.